Good morning, everybody, and welcome to Coffee with Craig. I am Craig DeLuz, and this is my coffee. And hey, we're here having coffee and conversation, talking about firearms policy, politics, you name it, everything Second Amendment related. So please like and share this video feed so that your friends can join in the conversation. Also, remember to subscribe to our YouTube channel. Also, follow us on Facebook so that you can get the alerts whenever we go live. Once again, be involved in the conversation as it is happening. Also want to remind you, FBC Gear. FBC Gear is where you can go and buy cool T-shirts that support the Second Amendment, help you share amongst your friends your support of the Second Amendment, but also knowing that every dollar goes to support the fight that we're engaged in from coast to coast. So it's, you don't just look good, but you can also feel good. Supporting the Second Amendment. That's FBCgear.com, FBCgear.com. All right, let's get into today's topic. I don't know if you guys have noticed recently, but a group in particular, the American Medical Association, for some reason seems to be dead set on the idea of coming after our right to keep and bear arms. There's a new effort that is being put forward by a number of different groups, including the American Medical Association, to have doctors engage in conversations about guns with their patients. In fact, at their annual meeting, the president of the American Medical Association, not only did he note that they have a history of advocating for gun control, but he talked as a part of his speech. In fact, the conclusion of his speech, the grand finale was talking about how aggressive the American Medical Association needs to be on the issue of gun control.
To those who feel we should not address this as an organization because it is too controversial, I would ask, did we shy away from fighting discrimination against AIDS patients in the early days of that epidemic, even though much of society stigmatized those with HIV? No. We let science lead us. And did we mute our opposition to smoking because big tobacco defended it? No. We let science lead us. And even now, have we backed away from our support on universal vaccinations or the gains made through the Affordable Care Act because they're controversial? No. We've let science lead us. So similarly, I would submit to you that the AMA must not back down from addressing gun violence. On the contrary, we must address it head on, scientifically, in an evidence-based, principled fashion, and with the health and safety of our communities, our fellow Americans, and our children as our chief concern. Okay, so let's break down his little speech right there. So this is all, once again, part of an effort where they want to identify gun violence as a health epidemic. And the interesting thing, if you look at all of the quote-unquote controversial things and positions that were taken by the AMA and the ones that he brought up, every single one of them were fundamentally medical and healthcare related. Whether it was the AMA, which really had more to do with, or the ACA, which really had more to do with funding, but even still, it still was healthcare related. Somehow they have just simply decided that guns and firearms are healthcare related. And I have yet to figure out exactly how they arrive at this idiotic perspective where they think they need to tell
people who know what they're talking about when it comes to firearms, they feel like they need to tell law-abiding citizens, people who know more about firearms, quite possibly, than they do about how they should, about whether or not they should even own a firearm. Now, Tucker Carlson did a really interesting interview with the person who wrote an article basically telling doctors that you need to have conversations with your patients about guns and tell them why they need to, quite frankly, not own them. Here's a part of that conversation.
Ready to get a gun control lecture next time you go to the doctor. Well, a recent editorial in the Annals of Internal Medicine urges physicians to start publicly campaigning for gun control while also pestering their patients about how unsafe it is to own guns. The editorial says, quote, "Don't let your concerns for perceived political consequences get in the way for advocating for the well-being of your patients and the public." Dr. Christine Lane is editor-in-chief of the Annals of Internal Medicine. She co-authored that piece, and she joins us tonight. Doctor, thanks for coming on.
Thanks for having me, Tucker.
So I was reading about this, and you all said over at the Annals that the massacre in Las Vegas spurred you to do this. And it got me thinking, would this have prevented that? Do you think if you had told Stephen Paddock that guns are dangerous, that he wouldn't have opened fire?
No, and that's not exactly what our proposal is. Our proposal is to treat firearm injury like a public health problem that it has become. And one opportunity to do that is for, in the exam room, for doctors to talk to their patients who are at risk for injuring themselves or others with guns about how to deal with it more safely.
So, but you're not an expert on guns. I mean, would it make you uncomfortable if I gave you medical advice?
Yeah, that would make me pretty uncomfortable.
Yeah,
Tucker,
me too. That's why I wouldn't do it.
I'm not an expert on guns, but I am a medical expert, and part of what physicians do is to assess risk and then help talk to their patients about mitigating those risks.
So let's just break this down. And I loved the best question that he asked was, well, wait a minute, you're not a firearms expert. How would you feel, doctor, if I were to give you medical advice? And she said, well, I wouldn't feel very comfortable. And you know why she wouldn't feel comfortable? Because she knows he doesn't know what he's talking about when it comes to medicine. Likewise, I'm sorry, but unless my doctor has provided me with some bona fides as to what makes them an expert on firearms, I don't understand why they would even feel it necessary. Even if they were an expert, it's none of your damn business whether or not I own firearms or how I store my firearms. Don't ask me. Don't ask my children. That's really none of your business. If we're friends and we're friends like that, and I feel like I want to tell you about my guns or my firearms or my firearm collection, I'll do that. But it is not a health. It's like saying, well, okay, well, how exactly do you drive your car? What kind of car do you own? How fast do you drive? Do you wear a seatbelt when you drive? I mean, what type of knives do you have? What type of rope do you have? I mean, if we're going to get into every single nook and cranny when it comes to how someone lives their lives and then work to, quote unquote, mitigate the risks, well, then let's really do it, right? Let's really get into and let's talk about mitigating the risk. In fact, in a separate part of that conversation, Tucker actually does go into the idea of mitigating risk, but not so much in a way that this particular doctor felt comfortable.
What would you acknowledge that there are people who ought to have a gun in the home? Like if you live alone in a tough area where there's a lot of crime, home invasions, would you ever say, it's probably better to have some way to defend yourself?
As a physician, I would not, I don't think that would be in my purview to do. I mean, it's certainly people's right in this country. But if that person was at risk of harming themselves or others, then I would be counseling them that maybe it would not be safe to have a gun in their home.
But what if they were at risk of being harmed? I mean, if the point of this is harm reduction, as you claimed it was, then, I mean, if someone was a delivery man, for example, in a tough neighborhood delivering the newspaper or delivering to bodegas at 3 in the morning, wouldn't you say it's probably better to be armed?
Actually, Tucker, there are data out there that show that if people have access to a gun in their home, it doesn't actually keep them safer. They're at much higher risk for completed suicide or for a gun homicide. People that have guns in their home.
So I
there's
guess
data to say that your assumption that having a gun in your home keeps you safer, there really are data that refute that assumption.
Yeah, I don't think you know the data, really, because when you take suicide out of that, it's a totally different picture. And that's a separate question I'd love to ask you about, whether you're against suicide and trying to prevent suicide. But let me just ask you, are you saying that there is no circumstance where someone is safer with a gun? Is that your medical position?
No, what I was saying is that in a systematic review published in Annals of Internal Medicine that looked at 16 studies that evaluated the risk of a completed suicide or gun homicide by whether or not the person had access to guns in the home, that the risk for both those things, a completed suicide and a gun homicide, was higher in individuals who had access to guns.
I'm familiar with those
home.
statistics, and they're misleading, and so I'm a little surprised that you're citing them.
So let's just be clear, and I think that she did everything possible to get around it. Her whole thing is she's recommending that they tell people not to have firearms. I mean, she clearly said that there is no instance. Well, she didn't clearly say it, but she refused to answer the question when he asked, are you saying that there's never an instance where someone owning a firearm would actually make them safer? And that's the thing. This is a political position that these folks have, and they're going into it. And that's the thing. They think that owning a gun is a health hazard. Period. They're not looking at empirical studies. They're looking at it like it's a disease. Like owning a gun is like cancer. It's like having cancer. And there's ways in which we can mitigate that. There's ways in which we can cut out the cancer. There's ways in which we can cut out the gun. And, interestingly, once again, the data that she is using is once again all based on the idea of there's a presumption that owning a firearm is bad. And first of all, I am not for medical doctors studying something that is more behavioral. If you want to talk about it, if you want to talk about something like this, maybe behavioral scientists or economists, people who actually study human behavior, because there are a lot of factors that they are probably not even including or not even looking at, because they don't. Once again, they're not looking at behavioral patterns. They're not into behavioral studies. They're treating it like it is a disease, like owning a gun or wanting to own a gun is a disease. And because of that, that's what they're pointing to. And it's also interesting that they're saying, and they noted other parts of this interview that, if someone owns a firearm, that 100 people, this was the guy from the AMA, he said 100 people die on average every day from firearm deaths. He ignores the fact that most of them are suicides, just as the lady who was on Tucker Carlson ignored the fact that 2/3 of them are suicides. But let's throw all of that aside. I have an interesting little thing. So if the whole idea is mitigating risk, if our whole goal here is to say that we want to reduce the number of overall deaths, there's one area that I would like to think that I think the AMA should be focused on and should be talking about. And when I listen to the entire half-hour-long speech by the outgoing president of the American Medical Association, this was a topic that I didn't hear him touch at all, not once. But it is an issue that causes 250,000 deaths per year. Guess what it is?
The medical journal BMJ says medical error kills more than 250,000 Americans every year. Medical error is now the third leading cause of deaths in the United States. The Centers for Disease Control says heart disease kills the most Americans, with the number at 600,000 per year. Second is cancer. And third, respiratory diseases such as emphysema and bronchitis. That number is at 150,000. Medical error causes more deaths in the United States than strokes, car crashes, Alzheimer's, diabetes, and suicide, and the list goes on. And it means more than 1 in 10 deaths each year in this country are caused by medical error.
Boom! So, Mr. President of the American Medical Association, if you really want to address something, that is in your wheelhouse, maybe y'all should be talking to each other and trying to root out all of those mistakes. Maybe we need to start talking about how we're going to restrict y'all and control y'all. Maybe we need doctor control or physician control instead of gun control, because clearly y'all are out of hand. Clearly, when you consider the fact that 250,000, that's almost 10 times more people die per year from medical malpractice than from firearms deaths. And that includes suicides, by the way, just in case you were wondering. So, yeah, doctors, no, you don't know any better. And in fact, this God complex that y'all seem to have, where you think that you are so smart that you need to meddle in every part of your patients' lives, let me tell you, you are not that bright.
Hi, everybody.
Hi, Dr. Nick.
Now, if something should go wrong, let's not get the law involved. One hand washes the other. Oh, that reminds me. These gloves came free with my toilet brush. What the hell is that?
That is not a firearm. So therefore it is, well, it may be your business. Anyway, folks, that's going to be it for today's Coffee with Craig. Thank you so much for tuning in. Thank you for liking and sharing these videos and telling your friends about the Firearms Policy Coalition. We are the home in the fight for civil rights. Got to use them or you're going to lose them. You guys take care.
If you like our videos, follow, subscribe, like, and share.